Hello, everyone. Thank you so much for joining me today for a very special conversation with Clemence Bideri. Clemence is our Economic Empowerment Manager in Rwanda, and for the last 8 years, she's been dedicating herself to helping women establish businesses, to learn how to earn and save money, and to make those cooperatives thrive for years to come. I am very lucky that just 7 weeks ago, as this COVID pandemic was just on the verge of hitting us all, I was in Rwanda with Clemence, and Clemence took me to see the most incredible work and hear the most incredible stories of impact. An events company, a tailoring company, a couple who are in couples dialogues to change violence against women, an agricultural cooperative, our Women's Opportunity Center. And I am really looking forward to hearing from you, Clemence, how life has changed for you and how it's changed for all these women, and are they able to continue their businesses? So Clemence, diving right in, I'd love for you to start by explaining a little bit, how has COVID-19 hit Rwanda? How is it impacting you? What's the government response been? And how is it impacting all of those women that you and I met together?
Yeah, thank you very much. As you know, the COVID-19 virus has hit the whole world, the whole globe. So I know you're also suffering the same. But here we are lucky because the government went straight ahead and slapped a lockdown 2 days after the first case was identified. And so we have been working from home since the 16th of March. And what this means then is that we are not physically able to interact in the office. And also we are not able to go to the field where our women are. But we have innovated and we are able to communicate with the women because that is the most important thing. It's communication, not necessarily the physical part. And so we have been able to continue the communication channels with the women out there, both the graduates and the participants. And we are doing this via phone calls, SMS, and WhatsApp. We quickly put up a list of representatives of graduates and participants around the areas where we work. And these representatives, we have been able to supply them with airtime so that they can communicate with the others, find out how they are doing, and also to update the staff at Women for Women International. We have also had to change how we pay stipend and other things. We have had financially to go digital. So the office now is doing internet banking, but also the participants in our program for the first time received their stipend via mobile money. So we encourage them to buy SIM cards registered in their names and to have them have the mobile money app. And we were able, through the internet banking, to transfer their stipends into their accounts.
That is just incredible, Clemence. I mean, I don't know if people can even appreciate how challenging this is. We're talking about women from whom many are non-literate, many whom, using a mobile phone and doing banking in that way must be completely foreign. You were saying to me earlier that even for our staff, suddenly having to go to internet banking was quite the difference. So it's just really incredible. I just have to say how you've pivoted. It's just how you've managed to find new ways to reach women. And I think it's going to really serve us well in the future. One of the things that you showed me when I was there 7 weeks ago is you had been doing a test between the savings and lendings groups that did the traditional way of coming together and bookkeeping by hand and sharing out. And then with a new Dream Save application, you were doing that with others. And so you were already starting to get involved with mobile, and we were able to see how much more efficient and effective and powerful it was for women. And now this is forcing you to do it faster and more. But what if, is it going all right? What are some of the challenges and how are you overcoming them?
Well, first and foremost, you have mentioned that most women do not even own a mobile phone. And if they have access to a mobile phone, the SIM card is not registered to them. And so that was the first hurdle we had, because they had to go buy a SIM card that's registered to their name. If we try to transfer stipends in the names of whoever else, even if it's a family member, it doesn't work. And so that was the first thing. But also, some groups, since we did that, some groups were ready to share out their savings. So what they did, they took advantage of the provision of the SIM cards to be able to transfer their savings. So they didn't wait for us to close down the accounts with them, to do the sharing out with them, but they decided, because they need some cash with them, that they will do it through the very SIM cards that we had asked them to purchase for the transfer of the stipends. So quite a number of groups now, as we are talking, have shared out their savings, their shares among the members, because they were able to reach the money from the financial institution and to load the money into their mobile money accounts and to share it out. So for me, that is the way we should be going. Yeah, going forward, I think that's the way to go.
I'm so impressed with that. Really, really impressed with that. Clemence, what are some of the other ways? I mean, I know your area of responsibility is the money and the earnings and the savings, but you're very aware of the broader program. What are some of the other things that are impacting women? I mean, some of the things we're worried about is, violence against women going up, people needing proper information about COVID-19. I know in some places there's a lot of myths and misunderstanding. Certainly here in the US, even there's a lot of myths and misunderstanding about how you might get treated. Tell us a little bit about some of the other impacts on women, what else Women for Women is doing to help them, what you've seen on the ground.
One of the most important things to note is that the COVID-19 lockdown came around the same time as the commemoration of the genocide in Rwanda. And during this time, we normally have very high trauma levels. And the practice has been that our staff go out, they reach out to the participants and graduates of our program in the different areas and try to assist them as possible. We went ahead and we decided to do that through communicating with them. So we have updates, and we essentially are telling them we are still there for you, even though physically we are not with them. And so also, what we have seen now is that some of the community members, some of our graduates have turned into trauma counselors themselves. So they are helping each other. They're giving each other a shoulder to lean on, which is for us really an excellent practice. So the social networking is really being put to practice now. They're caring for each other. And as far as the gender-based violence is concerned, they're an ear and an eye for each other. So if your neighbor is going through some sort of violence, they are the ones who are reporting to the local authorities and the police around them so that they can take action.
No, I think maybe people here in the US and around the world can appreciate even more now that the fact that almost everybody in Rwanda lost people during the genocide, lost neighbors, lost family members, and the incredible importance of taking time to grieve and remember, and that you do that as a country every year. And the fact that you weren't able to gather, I think now that people here haven't been able to have funerals, haven't been able to have weddings, can appreciate how hard that is emotionally to not be able to gather to grieve together. But one of the things that is just so incredible about the work you've done, Clemence, you and the team, is you brought people together from different ethnic groups who are on different sides, and they're in groups together and they're supporting each other. And when I visited and heard people talk about forgiveness and coming together, and now when this COVID hits, they're able to support each other because of the work you've done, that's just phenomenal, absolutely phenomenal. So do you know, I mean, in the communities and where women have gathered, I mean, is the lockdown and the social distancing measures strong throughout the whole country in rural areas as well as urban? Is it, what is it like for someone who depends on farming out in a rural area, or who depends on being in a tailoring cooperative, or who depends on, I'm trying to think of, oh, one of the fantastic cooperatives you introduced me to was the painting cooperative that was out there painting all the houses, which is a non-traditional activity for women. How are these women coping? I mean, it's been 7 weeks of, or 6 weeks, I guess, in your case, of, can they still earn money? Are they finding other ways to do their work?
It's very, very difficult. Actually, a lot of people have lost their jobs during this time because these are manual jobs, and yeah, except for the agriculture sector. The lockdown, you can go out to your field, you can go to till your land, because this is the time when we prepare and the land and plant our crops. So the government has been flexible on that, and we are allowed to do that, even though we still have to keep the social distancing. So the women's cooperatives that are involved in agribusiness, we have talked to the local leaders in the areas where they groups, and they have come up with a calendar, and they go out to the fields. That we received from some of our graduates is that the lesson on kitchen gardens was not, they didn't take it very seriously when they were in the program, but now it has become, for them, they think it is a necessity. It should be made a necessity that every household should have a kitchen garden, because that was like a first aid kit for them. Because once you're locked down, you don't know where to get food. That's the nearest place you'll rush to. So that was another lesson that we learned.
No, I mean, it's just fantastic. I mean, it's a government initiative that you've been part of to help everybody have food as well as cash income. And here I'm just laughing because over right next to me here in my little apartment with no access to land at all, we've started also growing. We've got lettuce, things growing with a little lamp going on over here. So the women that you serve have a head start on us. They already were taught how to have kitchen gardens, even if they aren't agriculturalists.
But the other thing also,
that helps highlight why it is so important that normally we give the stipends as an ability for women to learn how to earn and save and have a bit of support while they're in our one-year program. You've decided to continue giving the stipends, even though the training program itself has to be suspended, because you know how critical that cash is. And here in the US, even the government is giving cash to people because it's so vital, not just for the individuals, but to keep the economy going. So I think the ability you figured out how to do that is fantastic. You've talked about coaching women and staying in touch and giving them psychosocial support via grieving opportunities and opportunities to find out if they're being impacted by violence in the home. One of the other things I'd love to hear is, I know that you are applying to the government to have accreditation to be an official part of making and distributing masks. And can you talk a little bit about that? That is it's such an exciting initiative that I think we can also relate to here in the US, where everyone's scrambling. I ordered a mask 3 weeks ago and it finally came today. So there's definitely a shortage and a need. Tell us about that in Rwanda.
Early this week, about 28 companies were given the initial accreditation to make face masks, because the government said from Monday this week, everybody has to wear a face mask. And this is just for our own protection. And we know that it's a necessity, but also unaffordable to many. And so we, through the Women's Opportunity Center, are trying also to get the accreditation to produce face masks, but we have gone ahead and a graduate of our program has already tried out samples of how a face mask should look. We have even gone ahead and made them in sizes, different sizes, large, medium, and small, because we know there are plenty of children out there. They will also need masks. And so what we are waiting for is that accreditation, and we are moving forward. But our idea is that because many will not afford them, yet it is a necessity that we donate what we will produce to the vulnerable members of the community. So it's not for business as such, but it is as a support to the vulnerable members of the community where our target group belongs.
No, I just think that is such an incredible thing. So I know you've identified 12 cooperatives, all of whom have the ability to contribute to this. And even while right now figuring out how to distribute during shutdown is something people will only be able to distribute locally, we know that the need for masks is going to continue well beyond the shutdown, because we're going to have to stay safe as we continue to try to mingle. And I know you've come up with all fantastic ideas of when we can start resuming training, doing it in smaller groups, at more distance, and everyone will need these masks. And in Rwanda, it's a government mandate. So what we're doing here at Women for Women International is we're committing to help you raise that money. And we have a giving, an early Giving Tuesday on May 5th, and we have committed to have a campaign to raise $10,000 that will go to this initiative to buy all the materials these 12 cooperatives and the Women's Opportunity Center need to make masks. And I know you have an initial plan to make at least 2,000 masks, get those masks out there. And then, I mean, this is another example of how out of crisis sometimes rise opportunity. In the past, we've had different cooperatives in different areas. And although you've brought them together for incredible like trading fairs, and you've taken some of them to Kenya and to India to even have some international linkages, this is another form of linking women into a more powerful business where they can earn and sell together. In this case, give, because of the humanitarian crisis we're in. But I think it's so inspiring that you figured out how to do that, and that you're up there with the big companies going, we too can be accredited as a business. The Women's Opportunity Center, which is a social enterprise, allows us to get in there and do that. So just real congratulations, thank you. You make our hearts sing, because we know that in our small way, we can make a difference in protecting. On that image you just gave of all the little kids running around in little masks, just our opportunity to help keep people safe is just really, really powerful. So I would like to make this a bit more personal to you though, Clemence, and because all of us are searching inside of ourselves for how do we keep going. And we have good days and we have bad days. We have days when you just, wonder when is this gonna be over, or you get more fearful. What keeps you going? You're such an incredible, every time I come to Rwanda, I'm like, oh, Clemence just never stops. She keeps going. I remember the time that you took me for 14 hours. And how many cooperatives did we visit in one day? I think we visited like 14 cooperatives in one day on the other side of the country that required like a 5-hour drive to get there. So you are just extraordinary energy, always thinking of new things to do. And here you are confronted with being locked in your house and worrying about your family. I know you have family in Kenya as well. I know you lost someone in your family this week. So the fact that you're here smiling, pushing, even while you lost a family member and can't go back and grieve because she's in Kenya. How do you keep going, Clemence? What is your source of this incredible resilience?
Thank you for asking. One of the things that makes me go is that when you look at Rwanda, where it was in 1994, it was broken, devastated. Even people's hearts were broken, and their lives too. But 26 years along the way, you can see how far we've come. There is hope. So when you are down in the valley, I always believe that the only way out of the valley is your way up. And that's what keeps me going. I always say, yeah, tomorrow is a better day, will be a better day. And that's what keeps me going. When I look at these women, I know today they're in such a situation, tomorrow they'll be in a better one. So let's move together and ensure that they succeed and have a better tomorrow.
Clemence, that is so powerful. And you're so right. I mean, Rwanda is an example in the absolute depths of genocide, mass rape, and yet a country that has rebuilt itself, women and men who've rebuilt their families and their communities. So you're right. We have come back from worse as a people. So that was that hope that you have for yourself. I would love to hear more broadly, what does the future of hope for women look like for you? There's a hope for the future of women. What does that look like for you?
For me, I start with the heart, because my work actually entails giving hope to the hopeless and a voice to the voiceless. That's my inspiration, and that's what I believe. But I also know that you give us a lot, you at the headquarters, Laurie, and your team, give us a lot of support to try out any new things that we think can work. So innovation for us is the way to go. And indeed, I have seen our program transform women, both socially and economically. So I know that there's a hope. Our program actually delivers what it says it does. And therefore, if we were to get more support for a program like this, we would reach even more women out there and transform their lives.
Thank you so much, Clemence. I am so honored to work alongside powerful leaders like you, Antoinette, the rest of your team. It is just so important to see how you are serving the communities, and I know we'll speak again soon. Thank you for the time. For our listeners, you can all help Clemence and her team and Women in Rwanda. As I mentioned, we are launching an appeal. We need $10,000 by May 5th, which is also Giving Tuesday, to help us provide materials to the women in Rwanda to sew these face masks at home. They will be for the communities, they'll be for healthcare workers, they'll be for the children. It will help allow people to get back out safely, doing their trading, which is so important, being able to go out and get food. This can make an enormous difference. So please go to womenforwomen.org to find out more information. And please join me in saying an enormous thank you to Clemence. You have been the most inspirational part of my week, and I thank you for it. I really, knowing that you are out there helping serve women in Rwanda just makes me so proud to be at Women for Women, so proud to be able to support you. Thank you.
Thank you, Laurie. Thank you for your support too.
All right. We'll talk again soon. And thank you to everyone who's listening and joined us or looking at this message. Thank you for your interest and support in Women for Women International and our work in Rwanda. Stay safe.
Thank you. Bye.